So we will discuss about the topic. Today we will discuss about the topic that is the prolactin. Prolactin. Okay, prolactin. So what is the prolactin? So we will discuss about the topic that is the prolactin. Now, so prolactin. So why the prolactin is necessary? Why the prolactin is necessary, and what is the prolactin? Okay. So prolactin is the hormone. Okay, which is also secreted from the human body in the human body. So which part of the human body? It's the anterior lobe of the pituitary gland. It's the anterior lobe of the pituitary gland. Okay. Introduction. This is the introduction of the prolactin. Okay. We will serve introduction of the prolactin peptide hormone. So prolactin is the peptide hormone. Prolactin is the peptide hormone. Okay, it contains the amino acids, peptide hormone, protein. We can say it's related to the protein. It's a peptide hormone. So it is produced from the anterior lobe of the pituitary gland. It is produced from the anterior lobe of the pituitary gland. So it's a peptide hormone. It is produced from the anterior lobe of the pituitary gland, and the it's structurally it is similar to the growth hormone. It is structurally similar to the growth hormone. This is the brief introduction about the prolactin. It's a peptide hormone produced from the anterior lobe of the pituitary gland, and structurally it is similar to the growth hormone. It's similar to the growth hormone. Structurally it is similar to the growth hormone. Okay. So we will continue our. So what is the why the prolactin is necessary? Okay, prolactin is necessary during the pregnancy or during the lactation, during the pregnancy or the during, or it's significantly it is significantly necessary during the lactation, for breastfeeding of the infants, Okay. So so secretion of the prolactin rise markedly during the pregnancy. So secretion is increased during the comparing to the other uh, other part of the life, and mainly in female during the pregnancy, its secretion is increased, and it's reached the maximum at the term of the pregnancy. This is the maximum at the term of the at the term of the pregnancy, and decline thereafter unless the mother breastfeeds the infant. Okay, I will repeat it again. What is the significance of the prolactin hormone? So the prolactin hormone, the significant is clinical significant, or the significant is the for the during the lactation for the breastfeeding of the infants. Okay. So secretion rise markedly during the pregnancy, reach maximum at term, and decline thereafter unless the mother breastfeeds the infant. Okay. Other than that, prolactin release inhibitory hormone. Okay. It is also released from the this from the hypothalamus. So what is the role of the prolactin release inhibitory hormone? Like one of the example of the prolactin release inhibitory hormone is the dopamine. Okay, it is dopamine that is also released from the hypothalamus, and it inhibits the release of the prolactin from the anterior lobe of the pituitary gland. It inhibits the release of the prolactin from the anterior lobe of the pituitary gland. Okay. So I will repeat it again. What is the prolactin? Prolactin is the peptide hormone. It is secreted from the anterior lobe of the pituitary gland. Okay, it's structurally similar to the growth hormone. Okay, it's a significant secretion of the prolactin is during the lactation, breastfeeding of the infants. Secretion is rise markedly during the pregnancy, reach the maximum at term, and decline thereafter unless the mother breastfeeds the infant. Okay, and other than the prolactin release inhibitory hormone is also secreted from the. So regulation of the prolactin hormone is influenced by the prolactin release inhibitory hormone to inhibit its secretion from the anterior pituitary lobe. So dopamine is the one of the example of the prolactin release inhibitory hormone. Okay. So regulation of the prolactin. Okay, we will discuss in the picture. Okay. This portion is the okay. This is the schematic diagram. Only we will focus in this portion. Okay, this one is the schematic diagram. Okay, okay. This portion indicates the hypothalamus. Okay, and this one is the anterior pituitary lobe. Okay, you can see here. No, it's corresponding this picture. No, it's correspond this area corresponding to this picture. So anterior pituitary lobe. This portion is the anterior pituitary lobe, and this portion is the hypothalamus, and this portion is the target tissue. This portion is the target tissue, and this part is the hormone secreted. So what is the role of the prolactin? Okay, so hypothalamus So the hypothalamus, the prolactin releasing hormone or the prolactin releasing peptide, we can say prolactin releasing peptide or the prolactin releasing hormone, it is secreted from the hypothalamus cells, hypothalamic cells from the hypothalamus. So what are the stimulus? What are the stimulus for the secretion of the prolactin hormone? The stimulus for the secretion of the prolactin hormone. Number one is the most important, during the pregnancy, lactation. So suckling of the nipples by the infants during the breastfeeding. Number one stimulus is the suckling of the nipples by the infant during the breastfeeding, and the other stimulus are the oxytocin, okay, secretion of the oxytocin, okay, and the second, this is secretion of the thyrotropin releasing hormone from the hypothalamus, secretion of the oxytocin from the anterior lobe of the pituitary gland. They also stimulate the secretion of the prolactin hormone, okay. So once the prolactin hormone, they are secreted and then they are released. They are secreted and they are released from the hypothalamus, and from the hypothalamus they are traveled they travel to the hypophyseal tract to the hypothalamus. This one is the hypothalamus hypophyseal tract. Hypothalamus hypophyseal tract to the anterior pituitary lobe. Then they activate the lactotrophs cells which are present on the anterior lobe of the pituitary gland. By stimulus of the this prolactin releasing hormone stimulates the lactotrophs which are present over the anterior lobe of the pituitary gland, okay. So by stimulus of the lactotrophs of the anterior lobe of the pituitary gland, that secretes the prolactin. Now this prolactin, they secretes the prolactin, okay. Now this prolactin, okay, this prolactin they enters into the circulation and then through the circulation they reaches to the breast tissues, and the breast tissues, they 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 produces they activates the prolactin receptors which are present over the breast tissues. Mainly they have got the two types of the function. Number one is the memotropic effect, and number two is the lactogenic effect, okay. Memotropic effect is the growth of the milk secreting epithelium of the breast tissue, okay. Growth of the milk secreting epithelium of the breast tissue, like the ductal tissues, like the ductal epithelium, and like the lobulo-alveolar epithelium. These are the milk secreting epithelium of the breast tissues, okay. And the second is the lactogenic effect. The lactogenic effect is the production of the milk from the breast tissue which are required during the breastfeeding, of the infants, okay. So this one is the they are the this one is the prolactin. This is the, we can say, the regulation pathway for the secretion of the prolactin, okay. Prolactin. So I will repeat it again. So what will happen? Number one, hypothalamus, prolactin releasing peptide or the prolactin releasing peptide or the prolactin releasing hormone, they are secreted, they are produced from the hypothalamus. So what are the stimulus for the production of the prolactin releasing hormone? Number one is the suckling of the nipples by the infants during the breastfeeding, okay. Release of the oxytocin from the anterior lobe of the pituitary, or the release of the thyrotropin releasing hormone from the hypothalamus. They stimulates the secretion of the or production of the prolactin releasing peptide or the hormone from the hypothalamus. Now from the prolactin releasing hormone, they travel through the hypophyseal tract to the anterior pituitary lobe. They activate the lactotroph cells of the anterior pituitary lobe, so they secretes and release the prolactin. Now this prolactin through the circulation reaches to the breast tissue, where it activates the receptor present over the breast tissues and produces the two types of the function. Number one is the memotrophic effect, and number two is the lactogenic effect. So what is the memotrophic effect? Memotrophic effect is the growth of the milk secreting epithelium which are present on the breast tissue. So those epithelium are the ductal epithelium and the lobulo-alveolar epithelium, and the second effect is the lactogenic effect, which is the production of the milk from the mammary glands, so which is required for the breastfeeding, okay, of the infants, okay. So this is the regulation pathway for the regulatory pathway for the prolactin secretion, okay. Other than that, which factor inhibit the release of the prolactin? Prolactin inhibiting hormone. So one of the example of the prolactin inhibiting hormone is the dopamine. They also release from the prolactin inhibiting hormone. They also release from the hypothalamus. So they travel to the hypothalamus hypophyseal tract to the anterior lobe of the pituitary glands, and they they activate, they blocks the dopamine receptor. They blocks the dopamine receptor. They activate the dopamine receptor which are present on the lactotropes of the anterior pituitary lobe. So inhibit the secretion of the prolactin, which inhibits the secretion of the prolactin. As I have already discussed earlier, what are the functions of the prolactin? Number one function of the prolactin is memotrophic effect. Memotrophic. So what is the memotrophic effect? Increased growth of milk secreting epithelium in the breast tissue. So what are those milk secreting epithelium? The milk secreting epithelium are the ductal tissue, ductal epithelium and the lobulo-alveolar epithelium. Ductal epithelium and the lobulo-alveolar epithelium. So that's called the memotrophic effect. So number one function is it produces the memotrophic effect, which is the increased growth of the milk secreting epithelium in the breast tissue. Okay. Second is the stimulates the production of the milk. Stimulates the production of the milk. That is the lactogenic effect. That is the lactogenic effect. Okay. Other than this prolactin, oxytocin also induces the production of the milk from the breast tissue. That is because of the oxytocin. When oxytocin is produced, they also produce the memotrophic. They also produces the memotrophic mammary gland that causes the mammary tissue, contraction of the mammary tissues, that causes the stimulation of the production of the milk. Okay. Now there is the so these are the memotrophic effect and the lactogenic effect. Okay. What happens if there will be the deficiency of the production of the secretion of the prolactin? Okay. So that's called the deficiency of the prolactin is manifested by the failure to lactate. Failure to lactate. Okay. Deficiency of the prolactin is manifested by the failure to lactate. That's called the failure to lactate or the luteal phase defect. Okay. What is the luteal phase defect? Okay. Luteal phase defect is the so you will discuss about the luteal phase defect in detail in the reproductive system. So actually the luteal phase defect is one of the stage of the menstrual cycle, that occurs after the ovulation, and before the initiation of the menstrual period, before the initiation of the menstruation, before the initiation of the menstrual. So what is the deficiency of the prolactin? The deficiency of the prolactin is manifested by the failure to lactate or the luteal phase defect. So what is the luteal phase defect? Luteal phase defect is the one of the stage of the menstrual cycle that occurs after the ovulation and before the initiation of the menstruation. That's called the luteal phase defect. That's called the luteal phase. Okay, that's called the luteal phase. That's called the luteal phase, and the defect is caused by the deficiency of the luteal phase defect is caused by the deficiency of the prolactin. Deficiency of the prolactin. Okay, these are the functions of the prolactin. Number one is the increased growth of the milk secreting epithelium tissue in the breast tissues. That's called the memotrophic effect, and the second stimulates the production of the milk. That's called the lactogenic effect. Deficiency of the prolactin will result in the failure to lactate or the luteal phase defect. Luteal phase defect. Now, what happens if there will be the excessive secretion of the prolactin? Okay, that is called the hyperprolactinemia. That's called the hyperprolactinemia. That's called the excessive secretion that leads to the hyperprolactinemia. Prolactin secretion should be in normal range. If the deficiency will be there, that causes the failure to lactate or the luteal phase defect. If hypersecretion will be there, that will also causes the manifestation. So excessive secretion leads to the hyperprolactinemia. So that is manifested by the galactorrhea, amenorrhea, and the infertility in female. Okay, excessive secretion leads to the hyperprolactinemia, which is manifested by the galactorrhea, amenorrhea, and the infertility in female, as high prolactin level inhibits the secretion of the gonadotropin. Because the excessive secretion of the prolactin in female results the inhibition of the secretion of the gonadotropin. So what is the gonadotropin? Gonadotropin are the hormone which are secreted by the anterior pituitary lobe. So example of the gonadotropin hormone are the luteinizing hormone and the follicular stimulating hormone. Okay, luteinizing hormone and the follicular stimulating hormone. So we will discuss about in the reproductive system. Here only remember that excessive secretion of the prolactin will result the hyperprolactinemia, that causes the excessive presence of the prolactin level in the blood. Okay, so because high prolactin level inhibits the secretion of the gonadotropins like the follicular stimulating hormone and the luteinizing hormone. So that results in galactorrhea, amenorrhea, and the infertility in the female. So what is the galactorrhea? So galactorrhea is the excessive secretion, excessive and the persistent female breast. Okay, excessive and the persistent secretion of the milk from the female breast, irrespective of the breastfeeding by the infants. Okay, that is called the galactorrhea. I will repeat it again. What is the galactorrhea? Galactorrhea is the excessive and the persistent secretion of the milk from the female breast, irrespective of the breastfeeding by the infants or the children. That's called the galactorrhea. Okay, second is the amenorrhea. Okay, because they inhibit the secretion of the gonadotropin, that causes the amenorrhea. So amenorrhea is the cessation of the permanent cessation. It could be the temporary or the permanent. It's called cessation of the menstruation is called the amenorrhea. Cessation of the menstruation is called the amenorrhea, and the infertility is failure to conceive. Failure to conceive or failure to achieve the pregnancy is called the infertility. Failure to achieve the pregnancy is called the infertility. Okay, so I will repeat it again. Excessive secretion leads to the hyperprolactinemia, that is manifested by galactorrhea, amenorrhea, and infertility in the female, because the high prolactin level inhibits the secretion of the gonadotropin. So what is the galactorrhea? Galactorrhea is the persistent, excessive and the persistent secretion of the milk from the female breast, irrespective of the breastfeeding by the infant. Second is the amenorrhea, which could be the temporary or the permanent cessation of the menstruation, and the infertility is the failure to achieve the pregnancy in the female. That's called the infertility. That happens in the female. So now what happens in the male? Number one is the hyperprolactinemia results the loss of the libido and the infertility. So loss of the libido is the loss of desire for the sexual activity is called the loss of the libido. Loss of the desire for the sexual activity, that's called the loss of the libido. And the infertility in the male. Okay, so hyperprolactinemia results the loss of the libido and the infertility in the male. Regarding the preparation of the prolactin, so prolactin, no commercial preparation of the prolactin is available in the market. They are still under the development. Or only few countries, I think, developed countries, some countries they have that, but otherwise no preparation of the prolactin is available for the use in the prolactin deficient patient. Prolactin deficient patient, like the failure to lactate or the luteal phase defect, they are used for the failure to lactate or the luteal phase deficient. Okay, so these are the functions of the prolactin. Okay, excessive secretion results the galactorrhea, amenorrhea, and the infertility in the female, loss of the libido and the infertility in the male. And for the prolactin deficient patient, till now no preparation are available in the market. Okay. Now the prolactin inhibitors. Okay, prolactin inhibitors are present. Prolactin are not present. Commercial preparation of the prolactin is not present, but the prolactin inhibitors are present. Okay, what is the prolactin? So where they are used, prolactin inhibitors? So prolactin inhibitors, they are used when there is a condition that results the excessive secretion of the prolactin. Excessive secretion of the prolactin. What are those? Hyperprolactinemia. Okay, hyperprolactinemia. Okay, so prolactin inhibitors. Dopamine is one of the example of the prolactin inhibitors. Okay, they inhibit the secretion of the prolactin from the anterior lobe of the pituitary gland. So we will discuss about that, the mechanism. And other than the dopamine, one other drug, that's dopamine agonists, are also the prolactin inhibitors, like the bromocriptine and the cabergoline. Generally, this dopamine and the dopamine receptor agonists, they are used for the treatment of the Parkinson's disease. Because what happened in the Parkinson's disease? Parkinson's disease, the disease of the central nervous system, which is one of the type of the extrapyramidal effect that is characterized by the muscle tremor and the rigidity. And the cause of the Parkinson disease is because of the depletion of the dopamine in the basal ganglia of the central nervous system. So since there is a depletion of the dopamine in the basal ganglia of the central nervous system, so we need to replace the dopamine. So that can be done by giving the dopamine, or the other drug, that is one of the drug is the dopamine agonist, that are the bromocriptine and the cabergoline. Okay, so this dopamine and this bromocriptine and the cabergoline, they are the drug of choice for the Parkinson's disease. And beside that, they are also producing the prolactin inhibitor. They are the prolactin inhibitors. Okay, they are the prolactin inhibitors. How they produce the prolactin inhibitors, we will discuss about that. So the prolactin inhibitors are the dopamine, and the dopamine agonists are also the dopamine agonists, like the bromocriptine and the cabergoline. Okay, what is the mechanism of the dopamine as a prolactin inhibitors? Okay, they activates the dopamine 2 receptors on the lactotropes of the anterior pituitary gland. Okay, they activates the dopamine 2 receptors which are present on the lactotropes of the anterior pituitary gland. That will result the inhibition of the release of the prolactin from the anterior lobe of the pituitary gland. And other than that, they also inhibits the release of the growth hormone to some extent. Okay, so mechanism of action: they act on the lactotrope cells which are present on the anterior lobe of the pituitary gland, dopamine 2 receptor which are present over the they act on the dopamine 2 receptor which are present on the lactose of the anterior pituitary lobe of anterior lobe of the pituitary gland, and suppresses the release of the pituitary release of the prolactin from the pituitary gland. Okay, and to some extent they also inhibit the release of the growth hormone. This is the mechanism of action of the this dopamine and the dopamine receptor agonists. Dopamine, basically dopamine and the dopamine receptor agonists. They for prolactin inhibitors, as a prolactin inhibitors. Okay, any confusion? I think it's a very simple. Should I continue?
Yes, sir.
Now, indications, as we have already discussed earlier, what the indications of the prolactin inhibitor? Number one is the prolactinemia, hyperprolactinemia, because they results the galactoria, infertility, and the amenorrhea in the female, and the loss of the libido and the infertility in the male. So, for the treatment of those conditions which is produced by the hyperprolactinemia, we need to give the prolactin inhibitor. Okay, and other than that, the Parkinson's disease that I have already discussed earlier, because there's a depletion of the dopamine in Parkinson's disease in the basal ganglia of the central nervous system. We will discuss about that in the central nervous system. Just remember that this drug is also used for the Parkinson's disease and the acromegaly, because to some extent this drug also inhibits the release of the growth hormone. To some extent this drug also inhibits the release of the growth hormone. So that is the reason we need to give the acromegaly. Okay, in disease that's called the acromegaly. So indications are the hyperprolactinemia, Parkinson's disease, and the acromegaly and the
Yes,
Okay, last slide for the prolactin. That's the bromocaptin. What are the adverse drug reactions? Basically, of the bromocaptin, it causes the nausea, orthostatic hypotension. Let's remember these two: nausea and the orthostatic hypotension. And the other than that, dizziness and the headache and the psychiatric disturbances. Okay, I think this much is not necessary for right now. The important thing is the prolactin. What is the prolactin? Regulation of the synthesis, regulation of the prolactin. Okay, regulation of the prolactin, and the other is the regulation of the prolactin and the their function of the prolactin, their indications. Okay, their indication, and what are the prolactin inhibitors? Okay, that is important. Adverse drug reaction, bromocaptin, we will discuss about that in detail in the central nervous system, Parkinson's disease. Okay, so the bromocaptin causes the nausea and the orthostatic hypotension. At least remember that right now. So this is all about prolactin. This is all about the prolactin. So we will discuss okay, gonadotropin releasing hormone. Only we will discuss about the regulation of the pathway of the gonadotropin releasing hormone. Other thing we will discuss on the coming classes. Okay, so gonadotropin releasing hormone. Okay, gonadotropin. Okay, any question, any query for the prolactin? Any query from the prolactin? So what is the gonadotropin? Introduction of the gonadotropin releasing hormone. They are also called the gonadotropins. Okay, so gonadotropins, they are the gonadotropins preparations are the gonadotropin releasing hormone and the gonadotropin inhibiting hormones. Okay, so we will discuss only about the pathway for the secretion of the regulation of the secretion of the gonadotropin releasing hormone only. That's very simple. Okay, secreted by the neurons in the hypothalamus. Okay, and they are the decapeptide glycoprotein. They are the decapeptide gonadotropin releasing hormone. They are the decapeptide glycoprotein, and they are secreted from the neurons in the hypo. Okay, this is not important. They are the glycoprotein. Just remember the glucose and the protein. They are the glucose and the decapeptide glycoprotein secreted by the neurons in the hypothalamus. Okay, regulation of the gonadotropin releasing hormone. Okay, so what happened? Regulation. Okay, same thing. Okay, here now gonadotropin releasing hormone. So gonadotropin releasing hormone, they are released. They are secreted and released. They are secreted in the release in the hypothalamus. They are secreted and the release in hypothalamus. Okay, in hypothalamus. Okay, so gonadotropin releasing hormone, they are secreted in the release in the hypothalamus in pulsatile manner. So pulsatile manner is called the intermittent manner. Okay, at the interval of the 60 to 120 minutes, at the interval of the 1 to 2 hour minutes, at the interval of the 1 to 2 hour minute, that's called the pulsatile manner. What are the stimulus for the secretion of the gonadotropin release hormone? That is a dopamine. One of the stimulation of the release of the dopamine that stimulates the secretion of the gonadotropin releasing hormone from the hypothalamus. So what will happen now? This gonadotropin releasing hormone through the hypophyseal tract reaches to the anterior lobe of the pituitary gland and activates the gonadotrope cells. Which are present in the anterior lobe of the pituitary gland. That inhibits that stimulates the secretion of the gonadotropins that stimulate the secretion of the gonadotropins. So what are the gonadotropins? The gonadotropins are the luteinizing hormone and the follicular stimulating hormone. Luteinizing hormone and the follicular stimulating hormone. Then this secretion of this luteinizing hormone and the follicular stimulating hormone, what will happen? They will enters into the circulation, and then what will happen? This luteinizing and the follicular stimulating hormone, they act on the receptors which are present in male testes of the male and the ovaries of the female. Okay, so what happens in the testes of the male? The luteinizing hormone binds to the luteinizing receptor present over the testicular tissues, that release the testosterone. Okay, and the luteinizing hormone, it also acts over the receptors which are present in the ovaries, that stimulates the release of the that causes the release of the estrogen and the progesterone. Okay, estrogen and the progesterone. Okay, similarly the follicular stimulating hormone also stimulates the secretion of the estrogen. Okay, estrogen. So this is the secretion of the testosterone and the estrogen and the progesterone. When there is the excessive secretion, when the blood attains the excessive concentration of the testosterone and the testosterone or estrogen or the progesterone, what will happen? They will send back the signal to the hypothalamus and to the anterior lobe of the pituitary gland to further inhibit the release of the gonadotropin releasing hormone from the this hypothalamus, and the gonadotropins like the luteinizing hormone and the follicular stimulating hormone from the this anterior lobe of the pituitary gland. And other than this, gonadotropin inhibiting hormone also inhibits the release of the gonadotropin releasing hormone, that further inhibits the release of the luteinizing hormone and the follicular stimulating hormone from the anterior lobe of the pituitary gland. Okay, so I will repeat it again. Okay, so what will happen? Gonadotropin releasing hormone, they are secreted from the hypothalamus. Okay, so through the stimulus is the dopamine secretion, and through the hypophyseal tract that reaches to the anterior lobe of the pituitary gland, where they activate the where they activate the gonadotropes, that stimulates the release of the luteinizing hormone and the follicular stimulating hormone. This luteinizing hormone and the follicular stimulating hormone, they are the gonadotropins. And for this luteinizing hormone or the follicular stimulating hormone, they enters into the circulation, so they bind to the respective receptors present in the testes and the ovaries. So so from the testes, there will by when the luteinizing hormone, when it activates the receptor present in the test, it releases the release of the testosterone, and the luteinizing hormone over the ovaries will result the release of the estrogen and the progesterone. And also the follicular stimulating hormone also stimulates the release of the estrogen from the ovaries. And when there will be the excessive secretion of the testosterone, estrogen and the progesterone, so an excessive concentration achieve plasma concentration of the testosterone or the estrogen or the progesterone achieve, they send the signal to the hypothalamus to inhibit the further gonadotropin releasing hormone, or they send the signal to the anterior lobe of the pituitary gland, which further inhibits the release of the luteinizing hormone and the follicular stimulating hormone from the anterior pituitary lobe. This is called the negative feedback mechanism. Okay, so this is the regulation of this is the regulation for the release of the gonadotropin releasing hormone. That's, we can say, the follicular stimulating test, we can say the gonadotropins for the release of the secretion of the gonadotropins. Okay.